You're listening to the Future Tech Health Podcast with Richard Jacobs. Until I reached age 40, I never realized the obvious, that we all have medical issues, or we at least have a family member or close relation that had, has, or will have them in the future. Medicine and biological systems are the final frontier. Until we've conquered death, figured out how life began, cured cancer, and understood our purpose in the universe, there's a heck of a lot to talk about when it comes to our health. Future Tech Health means I'll be covering futuristic topics that are actually already in clinical trials, or even starting to appear on shelves or by prescription, or available for your own use. We dive deep into stem cells, CRISPR-Cas9, the science of sleep, epigenetics, medical testing, cancer, ketogenic diets, stem cells, aging, regenerative medicine, and more. My goal for you, the listener, is to learn from these podcasts. You may very well learn something that may change the course of your life for the better, steer you towards a new career, or give you insight into addressing a serious medical problem. Remember, however, this podcast and its content is informational in nature only. No medical, tax, legal, financial, or psychological advice is being given. If you enjoyed the podcast, please listen, subscribe, like, and share it with friends. Thank you.
Hello, this is Richard Jacobs with the Future Tech and Future Tech Health podcast. I have Dr. Hanan Elsaie. She's voted one of America's top dentists. She's a dental surgery graduate with broad clinic management. She provides excellent care. She speaks English and Arabic fluently, which is pretty cool, and some Spanish and French. And we're going to be talking about her work. So, Dr. Elsaie, thanks for coming. How are you doing?
I'm good. How are you doing?
Good. Yeah.
Yes. Good.
So tell me about your dental work. What's distinguished you as being rated a top dentist?
Well, there are a lot of things actually that do that, but I really think that the most important thing is just how your patients respond to you and how you respond to your patients. And I kind of take a holistic approach. I guess you could call me like a hippie dentist. I'm concerned about the patients wholly. And you know how it is.
I say, God forbid you look at their whole body and don't treat them just like an individual tooth or something. You know? That would be terrible.
Exactly. Yeah. No, but I mean, that kind of, unfortunately, just because of the way insurance companies are and their maximums, their yearly maximums, they focus on just, one tooth. But, how it is being in the dental chair. Being in the dental chair is quite frightening, correct?
Yeah, the light shines in my eyes, and they lean you back, and it feels like a loss of control, just leaning back, and then when they're putting stuff in your mouth and they're sucking out the saliva, and I don't know, the whole experience is annoying.
Exactly. So you said it. It's the loss of control. So basically, you have to psychologically understand your patient before they feel comfortable about you working on them. So that is actually the way that I steer them. But I'm into more natural medications, and I basically tell my patients to take quite a few supplements. And that's just simply because what ends up happening is that what patients don't realize, but now their dental IQ is definitely getting better. But what patients are not realizing is that having gum disease is pretty detrimental to your entire health.
Yeah, tell me why. What does gum disease look like when you see it, in various stages, and what's so bad about it?
Okay, so that is actually a very good question. And I will tell you that gum disease basically translates into a constant active infection going on in your mouth. So when you have a constant active infection going on in your mouth, and it is in relative degrees, in other words, you have just gingivitis, and when you hear that word, you become sensitized to it just simply because you hear it on the TV, on the radio so much that it appears to be not an active infection. So it starts off as gingivitis, and then it moves up the scale from mild, moderate to severe. And that basically is decided based on the level of bone loss you have and the amount of plaque that turns into tartar that you have. These things, these things actually allow us to diagnose the patients to the point of actually deciding whether or not they need a specialist, and those specialists are called periodontists. But what I really want to stress is that gum disease actually affects every part of your body, every organ system that you have, and it is, shown to contribute to cardiovascular disease, just your circulation and your heart. It contributes to diabetes, to respiratory problems, to osteoporosis, to kidney disease, and even cancer. So these things are pretty pertinent for patients to understand, because if you consider the kind of bacteria that exists in your mouth that is causing the gum disease, when it's going through your bloodstream, of course, it's wreaking havoc on all of your systems.
Yeah, so is it the fact that each tooth has access to your bloodstream, and that there's only maybe a few millimeters from a healthy gum line in the bloodstream, and maybe 1 millimeter or less, or who knows, or no distance between a compromised gum line and your bloodstream? Is that why bad mouth health can hurt you so much?
Yes, and it's just that bloodstream. And you're right about the level of bone loss. We measure it, I'm pretty impressed, in millimeters. That's actually the deciding factor as to whether somebody has gingivitis, to severe periodontitis, or severe gum disease. But there exists in our mouth, the second we brush our teeth, there is something called a biofilm that develops on our soft and hard tissue. And that biofilm basically consists of bacteria and their byproducts and like a mucous membrane, basically communicating with your mucous membrane, your epithelium and your hard tissue, destroying it. So it is an inflammatory response. And if you consider that it's an inflammatory response, every disease is an inflammatory response. So if your mouth is in a constant state of inflammation, again, therefore, the rest of your body just subsequently follows.
So what are some of the traditional ways of treating gingivitis or other mouth problems, and how is it different with your treatments? You said they're more natural. You'll do supplementation. Like, what are some examples?
So the protocol, which is, definitely important, is to, first of all, get checked up twice a year. And then if we were to find that you have gingivitis, we would give you oral hygiene instructions that include how to exactly brush, and that flossing is much more important than brushing, just because no toothbrush will be able to get in between your teeth. And then if it turns into more of a periodontal disease or worsening gum disease, then we actually mechanically remove not just the plaque, but the tartar buildup as well. And we have machines and instruments that allow us to do that. One of them is the ultrasonic. That's basically what we use the most. And that's just simply because it's using thousands of wavelengths, sonic wavelengths, to remove the tartar off of your gums and your teeth. So that is the conventional way. And it's definitely the most important way, the mechanical removal. Now, the supplements, they supplement. Dentists in general, and I'm not knocking this, but dentists in general like to prescribe prescription mouthwashes, and they suggest to their patients to, get mouthwashes over the counter. The problem with these mouthwashes, in my mind, is that they contain a lot of preservatives that are unnecessary just to maintain a shelf life, And they also contain, I am not an advocate of fluoride whatsoever, because if you Google fluoride and you see the damage that it does to our body from our brain down, it's not necessary. This is the hype that they want you to believe. So I do not advocate fluoride. I do not advocate any mouthwashes with preservatives. And I do not advocate any mouthwashes that have alcohol in them, because alcohol causes cell death. So that's something that I don't. So then, and the alternative to that is just basically saline. It's salt water. Salt water is a very potent anti-bacterial, anti-inflammatory, antiseptic. So I'm watching my patients as they're using the saline instead of these mouthwashes, and their gums are healing. I have to be careful about the things that I say, just simply because I have to say may contribute to antibacterial effects, may contribute to this and that. But if you study these things and you research these things time and time again, there is so much research and so much literature that supports this. Yes.
What is plaque and tartar, by the way? People, I've heard those words many times, but what is it made of? Have you seen any studies where they've, analyzed it and looked at the constituents?
Yes. So then basically the plaque is the soft film that is attached and part of the biofilm that we all wake up with, consisting of multiple kinds of bacteria that basically produce an acidic environment in your mouth. If left untreated, then what it does is it calcifies. So when it has calcified, it turns into tartar. And tartar is a lot more damaging than the plaque or the soft film, just simply because the tartar, once it contacts your bone, it starts destroying it, because it is so hard. So it infects your gums, it pushes your gums out of the way, and when it has pushed your gums out of the way, it contacts your bone. Once it contacts your bone, it starts destroying it. So there are sleeping cells in the bone. Those sleeping cells, once you've lost bone, you can regenerate more bone, but the more bone loss you have, the less likely you're going to regenerate that bone. So to answer your question, it's just, a petri dish, multiple different kinds of bacteria. Worst kind is S. mutans or Streptococcus mutans. That affects the teeth as well as the gums.
Oh, that's so interesting. Have you looked much about the microbiome of the mouth? Does that factor into dentistry, or is it too new and no one knows much about it yet?
No, there's quite a bit of research about it, and I have researched the microbiome of the mouth, and not only the microbiome of the mouth, I've researched the human microbiome. And basically what this concept is saying is that from birth on, actually literally birth on, depending on whether it is a natural birth or cesarean birth, certain and different kinds of bacteria start to form on the body and in the mouth. And it's relative. So after that, depending on, your habits, the quality of your saliva, and what I mean by the quality of your saliva is that the more viscous your saliva is, the less watery your saliva is, the harder it is for the saliva to remove things off of your soft and hard tissue. But it also depends on your habit. It depends on your diet, your hygiene. It also, the older you get, it depends on when your teeth actually first start to appear, what kind of fillings, what kind of restorations, if you have the denture, the temperature in your mouth, the pH particularly in your mouth, the nutrients that you consume, and your oxygen availability. So all of these things play into what specific kind of bacteria is in your mouth. And there's a slew of them, I think multiple different bacteria. But the most harming bacteria are the gram-negative ones, the anaerobic ones. Those are the ones that cause the most problems. And then also they produce sulfur, which is what causes the odor in our mouth. And most of our bacteria, by the way, 90% of it resides in the back of the tongue, at the base of the tongue. So there's still quite a bit of work that needs to be done, but I think that their research so far is phenomenal. I mean, so much information.
So what can you tell when you look in someone's mouth? You know, I'm sure you have like super dental eyes, so you see stuff no one else sees. So what are some examples of things you could tell just by looking at someone's mouth when they get into the chair?
Well, definitely we do oral cancer screenings. That is very important. And I check their bite. I check their airways. I noticed that you've designed a pillow, correct? Is that correct?
Yeah, that's to keep people's head aligned and their airway clear as possible. It stems from my own problems with sleeping.
Yes. I did read up on that on your pillow, and that is no problem. I have quite a bit of patients that come in with sleep apnea, and they don't realize the ramifications of not treating that. So that is one thing that I definitely look at. I look at just generally what's going on at every surface of their teeth, just making sure that there isn't decay. I don't overdiagnose because tooth structure, nothing is comparable to tooth structure. Nothing is comparable to tooth structure. So I'm very careful about treatment planning, trying to maintain the integrity of the oral cavity. And then, of course, the gums. There's no point in working on the teeth if the gums are not in healthy condition. So I look generally at everything to the best of my ability. And I have quite a few patients that are on appliances for sleep apnea. There are 2 or 3 ways to take care of that, one of them definitely being oral appliances, but as you said, just that the positioning too to open up airways, and the bite also has significant impacts on sleep apnea, because if you have an overbite, what ends up happening is that you've got a narrower airway. And then, of course, your tonsils, I check the tonsils just to make sure that they're not, oversized, because that can definitely contribute to that. I check, their hormones, if they're female, what's going on with that, depending on their age. I'm looking at the circumference of their neck. I'm looking at how, I don't know how to say this, whether they're obese or not. These are the things that I look at when I'm trying to figure out how to help them with their sleep apnea. Because, other than the appliances, the alternative is surgery. And I really do believe, all due respect to doctors, I would prefer for my patients not to go under the knife for any. And then finally, just the CPAP machine. And you can use the CPAP machine with the angulation of how you sleep, for example, with your pillow, with some kind of oral appliance. All of those things playing together are important. It's just a lifestyle change. And staying away from alcohol, staying away from sedatives. These are the things that I tell my patients.
How do they react? In doing these podcasts, I realize I'm going to a boring old dentist that doesn't tell me any of this, so I'm going to change. But on the other hand, you do all these things. An average person that goes to a dentist and then they come to you and you tell them about all these other ancillary things. How do they react? Do they say, you're a dentist, you don't know about any of this other stuff, or do they welcome it and they're happy? And what's people's reaction?
No, absolutely not. As a matter of fact, by the time I'm done talking, I tell my patients, this is an earful and a mouthful. And if I've spoken too much because I'm passionate about all of these things, I apologize. And 9 times out of 10, they're responding like, "Oh my God, this is so informative. I've not been told this before." And then after I stop talking about their mouths, I start telling them to take supplements like turmeric, because these patients, they have chronic diseases. And so Turmeric, for example, is a very powerful anti-inflammatory. Black cumin seed is a very powerful anti-inflammatory. There are honey, for example, just watching diabetic patients, but honey, for example, is excellent for your gums. Oregano oil is a very powerful antibacterial, antifungal, antiviral. Of course, these are all appear to be but I have watched these patients clinically, and I've suggested these things to them. I had a patient just a couple months ago tell me she had a joint issue. She has arthritis. And I'm not a medical doctor. I always have them check with their medical doctors, but the medical doctors are responding as well. And so she came in. This is just, yes, I'm so proud of that. She came in just praising me, and I don't like to be praised. I'm doing this because this is my job. This is what I love to do. This is what I'm passionate about. But she was ecstatic about how her arthritis had gotten better just simply by incorporating turmeric and black cumin seed, and I've got like a list of things actually that I have them take. Those are just the two things that come to mind because they're extremely powerful. I will tell you this. I have a friend, okay? He is a lawyer. He's a good friend of mine, and I was over at his house, and for the first time I met his wife, and she found out I was a dentist, and she started speaking to me how she found a way that it's unnecessary for people to floss. Of course, I slammed her down the second she said that because I absolutely will never believe that. I will never believe that. There's nothing you can tell me that would make me believe otherwise, But she got
There's a floss cause. That joke.
Yes, it's absolutely the mechanical removal of the plaque before it turns into tartar, and the brushing, of course, the floss and the brushing. That's the deal. And the way you brush too, at a 45-degree angle with a soft bristle toothbrush or a sonic technology toothbrush, which is much better. Okay. Not pushing very hard on your gums because that ends up being detrimental to the gums. But anyway, she went into her kitchen and started tinkering around with all of these oils, right? And she gave me a sample of she's a chemist and she's a naturalist, and she belongs to a nonprofit organization that helps all kinds of people. And I'm really into pro bono. I'm really into giving back. But anyway, she gave me the sample and she put it in a glass bottle, an amber glass bottle, because it maintains its integrity longer because it is an oil. It was sunflower-based oil. She was like, here, try this, right? So I tried it. I tried it for 3 months. And the things that I noticed in my mouth, first of all, I don't know if you're aware of something called pulling. Are you aware? Have you heard of pulling at all?
I've heard the term.
Okay.
It's like a leaching of something out of something else, I believe, but what is it?
It is, absolutely. So the most powerful pulling agents, and what that basically means is that you're removing toxins out of your mouth by placing either sesame seed oil or sunflower oil in your mouth, and you're keeping it in there, as long as you can, at least 5 minutes, okay? And you're spitting it out, but hopefully you're not spitting it out in the sink, of course, because those are toxins. It is toxic. So forgive me for saying this, but I spit mine in my trash can. I don't want it to put it back in the system. So what I noticed is that the way that she put all of the ingredients together, basically the effect of it but I noticed it in my mouth, okay? It definitely reduced the time that it took for the biofilm to form again. Remember, the biofilm forms and it's pretty sticky. It stays on for quite a bit of time. And it took a longer time for the biofilm to form. And then the things that she had in it, again, it all compounded each other. I'll just give you some examples of the stuff that she had in it. She had, of course, the turmeric in it. She had charcoal in it, which detoxifies. She had yucca in it. And yucca is basically a detergent. She had frankincense, she had neem, she had cayenne. Cayenne actually opens up the blood vessels and stimulates circulation. So, I mean, she's totally thinking about everything. She has xylitol in it. Xylitol is very effective remineralization. As a matter of fact, that's what we want in our mouth, our teeth to remineralize. And the Europeans, particularly the Germans, xylitol.
I thought it was a sweetener, right? Artificial sweetener.
It is absolutely a sweetener. Yes, it is. But what it does, the things that it does, is it remineralizes your tooth structure. Then, like I was saying, the Germans have been using xylitol. We look to the Germans a lot for new technology as far as dentistry is concerned. They've been using xylitol for years and years and years, shying away from fluoride. She had things like eucalyptus in it, tea tree oil. So basically, 3 or 4 years ago, I was thinking about coming up with something like that may have incorporated 5 or 6 things, but nothing is a coincidence. She graciously told me all of the ingredients in it, but she didn't tell me the amounts that she placed in. And I'm fine with that. So I started giving it to my patients and then just checking their gums. And I tell you what, and the thing is that it's oil-based, which to me is brilliant. It's a genius, because what she's doing is, instead of the conventional paste, she's pulling at the same time. And I looked at her after I used this stuff, and I was just like, if there's any way you can involve me in this, I am just, like I said, a few years back, I just started thinking about how I was going to approach this. And then there she is. I don't believe in coincidences. Not at all.
Yeah.
Just not at all.
Well, good question. As a clinician, you looked inside thousands of people's mouths.
Literally.
Is there anything that well, I mean, can you tell, for instance, if someone's a mouth breather or a nose breather? Can you tell if they have apnea? Like, just by looking, with your eyes, what things do you see that you're amazed that you can tell, or you seem to be able to tell?
Well, the first thing I request is for them to get a sleep test, because there's no telling exactly what's going on as far as their oxygen levels and their sleep apnea without, a proper sleep test. But I also ask them about dry mouth, and I also ask them if their spouse, significant other, notices they're snoring, notices if they're, holding their breath for 10 seconds. These things are, having a significant other next to you does help that. If they're waking up tired, if they're waking up with headaches, all of these things contribute. And then, of course, their health issues, because the apnea also can lead to blood pressure issues, heart disease issues, depression, even death, daytime tiredness. There are, multiple questions that you can ask just to kind of see. But you know what, though? I will tell you this. Most of the patients that come in already know. They just already know that they've got this sleep apnea.
Okay.
Yeah.
The patients are a pattern on the teeth, or the tongue looks a certain way, or again, if you can tell just by looking that someone has an issue, which would make you suggest an airway evaluation or a sleep study.
Well, I mean, again, it's looking at the patient as a whole. Believe it or not, the circumference of the neck has a lot to do with sleep apnea. The size of the tongue, the size of the tonsils, the actual occlusion or their bite. Like I said, if they have an overbite, or their jaw, if particularly their top jaw is narrow, or their bottom jaw is pushed backwards, then those are all indications that there's a big possibility that they have sleep apnea.
Okay.
Does that make sense?
Yeah, no, it makes sense, yeah.
Yeah,
So
great.
what are some of the, I don't know, are there any new advances in dentistry that you're starting to incorporate or new things coming that you're aware of and patients should be aware of?
I mean, I'm crazy about lasers. I really am. And just for basically everything, a lot of times these lasers make it unnecessary to have injections, and most patients do have to. I'm afraid of needles myself, by the way. So there are ways to give an injection that may be a lot less uncomfortable, and that's just, for example, heating the anesthetic to almost your core body temperature. So when it goes in, there's not, a significant difference, and it doesn't produce so much pressure. But back to what you were saying, the way that crowns are made now, the CAD/CAM system with crowns, oxygen therapy, again, doctors being more cognizant of the chemicals that we're putting in people's mouths, educating patients on conservative diagnosis. For example, if I'm able every single time not to do a root canal on a patient, there's medication that we can place that, well, I statistically 85% really it helps the patient not need root canals, but it works both ways. Sometimes the tooth blows up. So so that, and also just taking, again, a more natural approach, not using, for example, one of the things that dentists have used for years and years to perform these root canals is watered down bleach. I mean, I don't know what to say about that. But so these things, you have to be aware, using certain material. I'm so into cosmetics. So I practiced in Dubai for 4 years, and of course Dubai is just they're very into cosmetics and changing their smile. So I love doing that conservatively. These are the things and the material is getting much better. It's getting less toxic. So all these things.
What's a question about root canals? Do you do them? And is there an alternative to doing them? And what's the effect on the person once one is done?
Okay, so then the medication, that it's a liner is what it is. So you're removing, let's say 90% of the decay, 90%, all right? Let's say 95%, to where you can actually see the nerve, right? And you place this medication, this liner, on the tooth, and what that liner does is that it remineralizes, it hardens the tooth in that area and builds a bridge, if you will, between the nerve and the external tooth structure. So a lot of times that's just all that you need to do to prevent a root canal. Instead of placing the material that we use to do root canals. And by the way, the best dentists in the world use the best material in the world. The root canal statistically is still 50-50. We're placing rubber in your mouth. It is a foreign body, and then the way that we do perform the root canals, we're only getting the nerves that are vertical. It's very hard to get horizontal nerves. So one of the first things that oncologists sometimes ask their patients to do is to remove these root canal teeth. So the idea is to try to avoid them at all costs, because when they end up, unfortunately, but I tell you this, I'd rather keep a root in my mouth than alternatively placing a titanium screw in, in other words, an implant. But that's a viable solution. They used to think that implants did not cause the same kind of infection, let's say, that regular tooth structure produces. But as a matter of fact, in 10 to 15% of these implant placements, it's starting to look like they are causing infections, implantitis. They are causing infections. So that's why I believe that, titanium screw is man-made and the root structure is not. Right?
Okay.
Yeah.
Well, very good. What's the best way for people to get a hold of you if they want to be a patient? Like, what areas do you serve? And if they're not local to you, what are some resources?
Well, they can actually contact me directly on my cell phone. I will tell you that right now, the past few years, I've been trying to open some clinics that basically serve the underprivileged and also serve people that are just, middle class, people like you and I that, may have dental insurance and may not have dental insurance, to help them out, to, offer these services for a lot less, or even free. So I'm in the process of working with a nonprofit organization, and we're hoping here in the next few months to actually open up a clinic where we can serve these people. Veterans, for example, just serve these people and get paid some other way. I know that when I tell people that my dream has always been to do my craft for free and find another way to make money, they laugh at me, but I don't care.
Oh, that's fine. Well, it's been good having you, and I appreciate you being on the podcast.
Thank you. I appreciate it. It's nice speaking with you as well. You're very intelligent, for sure.
Yeah, well, I just spoken to a lot of people, so if I can absorb their knowledge, maybe that's what the effect is.
Definitely.
Hold on a second.
Sure.
Thank you. Hold on one second.
You're listening to the Future Tech Health Podcast with Richard Jacobs. Until I reached age 40, I never realized the obvious, that we all have medical issues, or we at least have a family member or close relation that has, or will have them in the future. Medicine and biological systems are the final frontier. Until we've conquered death, figured out how life began, cured cancer, and understood our purpose in the universe, there's a heck of a lot to talk about when it comes to our health. Future Tech Health means I'll be covering futuristic topics that are actually already in clinical trials, or even starting to appear on shelves or by prescription, or available for your own use. We dive deep into stem cells, CRISPR-Cas9, the science of sleep, epigenetics, medical testing, cancer, ketogenic diets, stem cells, aging, regenerative medicine, and more. My goal for you, the listener, is to learn from these podcasts. You may very well learn something that may change the course of your life for the better, steer you towards a new career, or give you insight into addressing a serious medical problem. Remember, however, this podcast and its content is informational in nature only. No medical, tax, legal, financial, or psychological advice is being given. If you enjoyed the podcast, please listen, subscribe, like, and share it with friends. Thank you.